was involved in health. It's a health organization. But I say this, and I've said this ever since, while I worked with PAHO and since I left PAHO. PAHO is involved in health, but health is wider than medicine. I said it when I became chairman of the hospital board in recent times, because I had doctors all around me, and I would look at them and say, all I hear you all talking about is cutting people, stitching them up and so on, but health is wider than medicine. Well, what am I getting at here? I'm saying that if you try to prevent people getting, here I was as a chairman of a board of a tertiary health institution, and I should be selling tertiary health. You come in and you get your operation, you do this. No, I never will sell tertiary health. Tertiary health should always be the very last thing. What I tried to sell, and what PAHO sold me anyway, was the beauty of primary health care, what some people know as preventive care. The emphasis should be on wellness and not on sickness. And the way you do that is to have people going to the clinics, have the clinics open at a time when they're accessible to people, so as to stop people going to Holberton and now Mount St. John. What do we have now, Testy? We have people going, as soon as they have a headache, they go to Mount St. John. It means that someone who really needs the service of Mount St. John has got to, that's why they have to wait for all these hours when they go there, because half the people in there ought perhaps not to go there. But I can't blame the people, because if our health centers are not accessible to them at the right time, they'll always go where they can find doctors. You know, that's why I said medicine, health is wider than medicine. A lot of our people still believe that the minute they say health, a doctor has to be there, and not so. I joined PAHO in the year 1978 after 6.5 years teaching at the University of the West Indies. And that was preceded by another 2 years teaching at the University of Birmingham in England. So I was at Birmingham University in England, where, by the way, I was a student, because I took a master's degree there, and went back there to teach at some point. And then I got recruited from there to the University of the West Indies. So that is how I got into teaching. That started my professional life as a social scientist. I did the usual things in the social sciences: economics, politics, sociology, public administration, which is a subset of politics, and so on and so forth, and taught those subjects by and large at university level. During this period while I was teaching, I developed an interest in public policy dynamics, and something that you don't hear talked a lot about, except I see that we do have a minister that has that attached to his portfolio, something called public administration, which is a subset of political science. Now, how I made the movement from just dealing with the social sciences into health was that while I was at UWI, and I taught in the social science faculty, and specifically in the Department of Government at the University of the West Indies, we had overlapping courses with nurses doing graduate work and doctors doing graduate work in public health. And I was one of the faculty members assigned to work with them on the whole area of public management as pertains to public health and so on. And through that I began to develop a fascination with health. Moreover, if I may be a little bit personal, my wife happened to be, a lot of people don't know this, she happened to be a trained nurse and midwife, British trained nurse and midwife. She went on later on to do a master's in public health and family planning and AIDS, and most people know her as the AIDS person, but her background really started being nursing and a midwife. So I began to have a fascination with health, with the whole health services. And having done that, and particularly in health services organization and management, and it occurred to me that that led to the university offering me during the period, the long summer vacations, or not the university, but PAHO offering me consultancies just about every English-speaking territory in the Caribbean to try and troubleshoot areas of their health organization and health management. And I became even more fascinated, because what happens in, say, St. Vincent is not the same that happened in St. Lucia and so on, and I became very fascinated. And then it occurred to me that to do this thing properly and more effectively, I perhaps ought to go back to school and get what we call in business, to get myself retooled. So I went back and did a course, and a very intense course at what is called the London School of Hygiene and Tropical Medicine, which is a school of London University, where the concentration in that school, in that course, was in health planning and health economics. Because although I had done economics, I had not done, if you like, there's there's a special nuance to health economics. So when I got back, I felt more, as it were, in a better position to do what I was doing as a social scientist, but also to give help in the area of health management and health organization. Now, it was at that time that I made this transition from teaching at the UWI to transition into PAHO WHO, for whom I had done a number of consultancies, and who, based on those reports I'd given, asked me whether I'd be interested in coming full-time, because I'd known a number of people by then in PAHO, because I'd been working backwards and forwards between the university and them, and I said yes, and that's how I made the crossover into the Pan American Health Organization. But what was coincidental and interesting, here am I, with health, with management, with organization theory and behavior, and then the government of the Bahamas, seemingly, I had no input in this, had approached PAHO for a consultant, an expert, they call you all sorts of names in this business, to come to reside in the Bahamas to help them with the health services administration, the health services organization. And so when I got recruited to PAHO, I had to disrupt my life to go and live in the Bahamas with my family to meet the request of the Bahamian government. So that's one, how I got into PAHO, and two, what I always started off in PAHO. So here I was, I'd gone into the Bahamas as a solitary person going in to target a particular area. And then I was able, while there, to identify a number of other needs, which I would point out to the then government. But at that time, I couldn't move smoothly into seeking to deal with these needs, because obviously I was an outpost from the Jamaica office, that was the office that controlled what went on for PAHO in the Bahamas. So I really was a staff member of the Jamaica office, having to live in the Bahamas. And then this became apparent to the then Minister of Health, who I might tell you was somebody whose name might be familiar with you, the Honorable Perry Christie was then the Minister of Health. So he is my immediate counterpart. He's now the Prime Minister. That's how things move. And so he asked me one day very simply, Sam, does this always have to be so? When I want something in the Bahamas, do you have to run to Jamaica to get permission to do it here? And I said, as it stands now, that's how the structure is. If you want this change, a lot would lie on you as a Minister of Health in the Bahamas and the Bahamas government. You would have to approach a director of PAHO, point out that you would like a fully fledged country office in the Bahamas, but you'd have to be prepared to put your money up front to support such an office. And to my, well, it wasn't surprising, because the Bahamas in those days, and still is, if they want something, they go after it. And so he made that request to the PAHO director. And in relatively short order, the PAHO office, what became Sam Aymer working in the Bahamas for the country office in Jamaica, became Sam Aymer working as the country representative for PAHO in the Bahamas. It then meant, what this meant to the Bahamas is that I could go out and directly try and source technical assistance and technical cooperation for the Bahamas government. And so that's how that's how I ended up, and that was the start really of the Bahamas PAHO office. The Americans use a phrase, this was a big deal. To me, this is a big deal, because it now meant I now had to develop, from doing my own resource, I had to develop an office to carry my program, plus other programs that the Bahamas government were beginning to determine that they needed. And so, and I'm pleased to report that the Bahamas office today is one of the more vibrant offices in the PAHO network of offices. And if you don't believe me, you can ask Dr. Merle, that she's just come back. Since that time, they've had at least maybe 4 or 5 country representatives since my time, and they've done a lot of work in the Bahamas. As you know, it's a vast place. People don't understand the Bahamas. It's a country of, there's about 24 inhabited other islands. For the tourist brochure, they advertise themselves as being comprised of 700 islands. but some of them are not inhabited, but certainly up and running inhabited islands that need management and help, needs health structure. This is why their problem when they first asked for power help was in the whole business of organization, because you have 24 islands that you have to provide health care for people across a vast network of islands. You'll understand that one of your problems is organization and management. I feel a little bit immodest saying it, but after we were, as I said, we got the office moved in 2 years, an outpost into an office. And as you know, you're working along on a day-to-day basis, and you ask yourself, are you doing these things? Are you being effective? Are you being efficient? You might tell yourself you are. But then when you get confirmation, I was called from head office in Washington one day out of the blue, because I had nothing to do with it. This is internal workings of the head office. They said, we're pleased. I got a telephone call from our personnel section saying, and as a matter of fact, I was just wondering at that point in time, what did they bother me for now? Because you relate to Washington all the time. And there's a guy, I remember his name quite, a guy called Custy, and he said, Sam Coolett, I have good news for you. They just come out of a selection committee, and you've been awarded the award for excellence for 1988, excellence in administration, in the field of administration and the management of power services in the field. And that, another thing, was another big deal, because they really put themselves out. They paid for me to go to Washington, for my wife to go to Washington with me, and they gave me a nice big, I don't know if it's gold or brass, but I still have it, medal and all sorts of things. So that was another big deal for me, and that is one of the things I cherish a lot, because it said that somebody, you have no say, it's not something you can canvas for. They look at your work at headquarters and maybe what they've heard from other areas in the situation. And I believe it is because I had moved this thing from nothing into a full and vibrant office. Once you move into a country where and you are a member of the United Nations family, people think that you bring something. You always bring something, but sometimes the something you bring is yourself, your skills, what you can do to work along with the government. And so, both when I was in the Bahamas and when I was in Jamaica, I always argued that PAHO is not a funding agency. What it is, its forte is in giving technical assistance and technical cooperation. Yes, we bring some monies in, but we try to tell governments up front, we're not the IMF, we're not the World Bank. We are a technical organization, and what we bring to your country, working with your nationals, is our experience, our expertise, and what we don't have, we know where to go and get it from. So that is where PAHO's strength is, and we refer to that basically as technical cooperation or technical assistance rather than monetary assistance. Yet, yes, I will tell you, going along with that is money. We do have a budget for the country, a budget to assist the country with fellowships and training and so on and so forth. So I would always say that is the I start by saying it is not the forte of PAHO. But PAHO knows that. And so PAHO has been doing excellent work in technical assistance and technical cooperation, in addition to adding some dollar signs to it. I would argue that for PAHO to continue, PAHO has to remain relevant to the country. It's no point coming here with technical cooperation you practiced 30 and 40 years ago, because things have changed, are changing here. So they have to be relevant to the in their technical cooperation, it must be relevant to the countries. The other thing is, you ask me where I see PAHO going, and PAHO knows this, I don't have to tell them, but it's worth just underlining it. It must retain its grassroots orientation. PAHO is here's Mr. Manuel, he's underground. He sees what he should, if he's doing his job properly, should see what Antigua needs from the point of view of public health. And it's his job to press the buttons and send the signals to the wider PAHO community. This is what Antigua needs. Your needs might change too. It's his job to be sensitive enough to see. That's what I mean by relevance, to see what Antigua needs and to send the right signals to the right places. And then, this is a little technical. I have just jotted here that I think that PAHO would be well advised to revisit what I call the alma mater principles. This is an in-house thing. In 1978, the world met in a conference in alma mater in Russia and determined that primary health care was the way to go. And PAHO and WHO had embraced that and was selling this throughout the world, and particularly to our region of the Americas. I see a falling off on that. In fact, I just mentioned, I hinted to it earlier. I want to see us return to developing solid primary care. And your own minister, Mr. Daniel, has said this, develop solid primary care facilities so that we have not only nurses and so on, but some doctors in our primary care units so that they can go to the primary care units and do, when, you know, there's no reason that you have, if you come home and your baby's not feeling well, that your first thought is rush, except the child was limp and scared you and turning blue. The child has a cough, so you go to Mount St. John. There might be somebody coming in, God forbid, with that had an accident that needs, because that is tertiary care we're dealing with. They should be able to go to a Johnson Point clinic or a Clear Hall clinic or Browns Avenue clinic, and with that baby, there should be a team of health professionals there, including possibly, doesn't always have to be, because there's a category of person called a health practitioner, who's just as good as the average general practitioner, would be able to. Indeed, in England, when you go to hospital, the person who triages you and admits you is not a doctor necessarily, it's a nurse who is a health practitioner. But we have this doctor-oriented thing, unfortunately, that says nothing can happen in health except a doctor is there. It's not necessarily so. In my early days, not one of us, my mother had 6 children, not one of us was born in a hospital. I mean, you can see what that means. What was the alternative? A midwife came to your home and we didn't die. But now, as soon as you get pregnant, it's a hospital. And that's the situation. Well, from what I've said so far, you must know that that I enjoyed working with PAHO. I learned a lot working with PAHO. It really solidified my interest in health and in public health, and that interest has not waned. And you will know that interest has not waned because I came home here minding my own business, and I ended up being the Minister of Health in my own country. And that is another, that's for another time, because there are a different set of dynamics with that. The political side I didn't particularly care for. But when I was offered the opportunity to become the Minister of Health, what I saw was the training I got in PAHO and WHO. I think that's what the Prime Minister saw at the time. But I, being a technical person, having trained in the technical, I thought, okay, maybe God is giving me an opportunity to practice what I've been doing in the Bahamas, in Bermuda, because these are the places I actually work, in Turks and Caicos Islands, in Cayman Islands, and in Jamaica. And I thought if I could do it there, I could do it here. What I didn't reckon with is something called the politics of it. But I enjoyed it, so it kept me, it really kept me, PAHO really kept me focused on health and healthcare, because I just think it's an area of our development that we must not play down. And as you may or may not know, we are seeking to, even as I left when I was leaving the hospital recently, and you know, we moved our hospital from in just over a year, from being just a hospital to being a teaching hospital. And I really pushed for that to happen. And just as I was leaving, we are moving into the possibility of a cancer center. So as you can see, I've bitten the health bug has bitten me, and it will continue, I think, throughout throughout the rest of my days, however long or short those are.